Nurse Viola was known for her radiant smile, calm demeanor, and dedication to her patients. She was a nurse of color working at Lakeside General Hospital, where the values of care were often muddled by the rush and bureaucracy of modern medicine. In a fast-paced environment, nurses were expected to work efficiently, but for Viola, her work was more than just a job. It was a calling. She believed deeply in value-based care, where the quality of care mattered more than the number of patients seen, and where the essence of nursing, the compassionate touch, the listening ear, and the ethical approach should never be compromised. Viola had a simple philosophy: treat each patient as if they were family. She took the extra time to ensure that her patients understood their treatment plans, often sitting by their bedside to explain complex medical terms in ways they could grasp. She listened intently to their concerns, provided comfort, and meticulously followed up on every aspect of their care. Her dedication, however, made her stand out, not always in a positive way among her colleagues. Some nurses whispered about her behind her back. "Why does she spend so much time with each patient?" one nurse would mutter. "Does she think she's better than the rest of us?" Another would sneer. The subtle slights grew. Some nurses would deliberately make her tasks harder, overlooking her requests or being uncooperative during shift changes. They labeled her overly thorough or too ethical, as if those were negative traits. But Viola remained unfazed. She knew that her work wasn't for recognition or approval from her peers. It was about upholding the nursing code of ethics and doing right by the patients entrusted to her care. One day, an elderly patient named Mr. Johnson was admitted to the hospital with a severe respiratory infection. He was frail, disoriented, and had no family to advocate for him. Other nurses saw him as just another difficult case, but Viola saw him as a vulnerable human being in need of exceptional care. She noticed small details that others overlooked: the way he winced when lying flat, the subtle swelling in his feet, and the confusion in his eyes that suggested more than just a respiratory problem. Viola alerted the doctors, pushing for further tests. Her persistence led to the discovery of an undiagnosed heart condition that was exacerbating his illness. Viola worked late into the night to ensure that Mr. Johnson received the proper care, arranging follow-up treatments and coordinating with specialists. Slowly, he began to recover. He wasn't just getting better, he was thriving, all because Viola had taken the time to listen and go beyond what was expected. Word of Mr. Johnson's miraculous recovery spread through the hospital. But as always, Viola remained humble, focusing on her work rather than seeking praise. A few weeks later, the hospital administration received a letter from Mr. Johnson's family, who had flown in from out of state after learning about his recovery. The letter described how Nurse Viola had gone beyond her duty, not just treating Mr. Johnson's illness, but treating him as a whole person. The family expressed their profound gratitude, explaining that Viola's actions had restored their faith in the healthcare system. Shortly after, Viola was called into a meeting with the hospital board. She feared the worst. Perhaps her thoroughness had once again been viewed as a hindrance rather than an asset. To her surprise, she was greeted with smiles and applause. "Viola," the director of nursing began, "we've received overwhelming praise for your work, not just from Mr. Johnson's family, but from numerous patients over the years. You exemplify what value-based care should look like. We are proud to recognize your extraordinary commitment to the nursing code of ethics, your compassion, and your dedication." Viola was awarded the hospital's highest honor, the Compassion in Care Award, and the administration took steps to shift the hospital's focus toward value-based care. Training sessions were introduced to emphasize patient-centered care, and Viola was asked to lead workshops on ethical nursing practices. The nurses who had once sneered at her now listened attentively, learning the importance of compassion and integrity in their profession. The lesson was clear. Value-based care wasn't just about treating a disease. It was about treating the whole person. And those who uphold ethics, even in the face of adversity, ultimately changed the system for the better. Nurse Viola had not only touched the lives of her patients, but had transformed the culture of the hospital itself. As Viola stood before her peers, receiving the award, she felt a deep sense of fulfillment. It wasn't about the recognition. It was about knowing that she had done right by her patients. And in doing so, she had paved the way for a future where compassionate, ethical care would be the standard, not the exception. "You said